Hi, good morning, one and all. I'm Dr. Priyanka, and today we'll be continuing our last lecture, that is laboratory procedures for frame. Okay, so the learning outcome, we have covered the first learning outcome in our part one of the lecture, so we'll be covering these three other learning outcomes today, and that is the recall, the step-by-step procedure involved in removal partial denture insertion, explain appropriate post-insertion care for patient receiving removable prosthesis, summarize the post-denture insertion problems and its management. So coming to the steps and fitting of the framework. So first we will be examining the framework. We will be after that checking the fitting of the framework, and seeing the supporting teeth and the soft tissues, how it's fitting around these two areas. Then we will check occlusion, okay, in according to the opposing arch, which was already present. And then we'll be doing finishing and polishing, and then we'll be discussing. Okay. So coming to examination of framework, so the metal framework should be examined carefully once it returns from the lab. So there can be a lot of problems. Sometimes you find sharp edges. Sometimes you find that there can be some casting defects, but usually the lab will not send a casting defect framework. Um, Few times you will realize something is loose, something is too thick at some certain arrest seat area, and the looseness, you'll be able to see the looseness or tightness in the patient's mouth. So things have to be still examined for the body. So yeah, there you go. Things to be checked in the metal framework. So the rigidity and placement of the major connectors. Okay, so this is a major connector. Everything has to be checked properly. Okay, even the sharp edges, usually things are rounded. The lab will send you a proper work, but again, from your point of view, you have to check everything again. You have to check that all the rest seat preparations have been included. Okay, so everything has been included properly and he has not left out one of the rest seats. Okay, and obviously one thing which here it's not written is to check the framework designing, that whatever extent and whatever major connector, minor connector, wherever you're placed, the extents and the retainers, everything are placed at the right place. Check all the clasp assemblies which are present complete. Okay, so the clasp assemblies, check whether the retentive clasp one displays the appropriate size, shape and position. Okay, all right, so the shape and position, where should it be? Was it an infrabulge, suprabulge? Where was it? Okay, everything has to be checked properly before you place it. Okay, so now coming to the um clinical work yeah guys, sorry, so we are talking about the clinical procedures, and it here comes the fitting of the framework to supporting teeth and soft tissues. So here we need to see an accurate fit, especially for the success of our treatment. Okay, and also we need to see any sharp edges, any displacement in seating. If any is there any redness when you're placing the framework? So everything has to be checked, and then we'll come to you know checking the occlusion, everything later. So how would you check it in the mouth? So to check the proper fit of the framework in the patient's oral cavity, so there's something known as a disclosing media. So disclosing wax can be used and it provides an excellent result. So just melt it in a wax spatula and just pour it. So the areas of excessive pressure and areas of good adaptation should be identified. So you can see here there's excessive pressure and it's really thin, understand, and here it's just fitting fine. So there is no exposure, or it's not thin, it's just even. So it should be even. Yes, this is just a method of checking. We actually don't check it like this in the department. We can see it orally in the patient's mouth. This is one of the ways, guys, it can be checked. Okay, so now coming to the occlusion, which is very important. So fitting the framework to the opposing occlusion. So the framework must be adjusted to the opposing occlusion. The natural teeth must be able to make normal occlusal contacts, okay, in centric and eccentric closures. So everything has to be properly in occlusion, guys. Okay. And you know how you can identify if it's a class 1 2. Usually, yes, we try and place everything in a class 1 relationship, and molar to molar relationship, guys, and it can be checked and adjusted if there is a problem. Okay. Sometimes if the receipt is too thick in the metal framework or surface, uh, it can create a high point or a premature contact in the occlusal intercuspation when the patient bites. So sometimes you will have to trim that out and thin that occlusal contact. So there are many things which come up. Sometimes it's perfect, so you just have to see and properly that. Okay. Coming to the finishing and the polishing, all the corrected surfaces must be finished and polished properly. Okay. Everything should be polished properly, and yeah, uh, you can see and polish it more if required, but um, the lab actually finishes and polishes it for you, the metal framework and metal surfaces, because you do require special metal trimming burrs for those surfaces, so they do it for you. And if there's some rough patch or areas, then we can finish that little bit part, proceed further. Okay, so coming to the post insertion care in RPD for patients. So it will take time and patience to become comfortable with the new processes. Guys, we see that time and again and again and again. We'll keep seeing it. Patients cannot exactly fit to new processes on day one or at that time. You give it time. Sometimes the patient comes for a recall one time, sometimes twice, sometimes three, four, five times also. So guys, it's completely okay. Patients takes their own time, and there are the fit and the oral cavity is different for all the patients, so things take time, and it's completely normal. So, home care brushing of your new dentures or partial dentures should be done. Soap this solution alone do not always clean the processes completely. So, you have to do brushing also of your remaining teeth, also of the prosthesis. Okay, it's a very important thing. When placing the partial denture in your mouth, seat it place it with finger pressure. Avoid biting it into place, because this may cause clasp or precision attachment to break. So um, you have to apply slow finger pressure. It can be a clasp or an attachment, whatever. So anything has to be seated well in mouth, and you have to learn. And you have to teach the patient, give him a mirror or her a mirror, and teach him how to take it out, how to place it, and then only, and see that he can learn, and then only send the patient. So they apply proper pressure, and sometimes the path of placement is not one, it's um, from one side first and then the other side. So you have to see and make the patients learn that well. Okay. So the patient should not be wearing the denture 24 hours a day. So especially cannot wear it during sleeping. We need time for the tissues and muscles to relax and the blood vessels. So you cannot have that tightness the whole time. Okay. And the prosthesis should be left in water when out of the mouth. So either it can be in the mouth with the saliva, or it can be a bowl of water. Okay. And the bowl of water can be a bowl of water, it can be a jar of water, and it has to be cleaned regularly. Okay, even your mouth, even the bowl of water or the jar of water. So if you're traveling, you don't want to wear it, it should be in the jar of water. Okay, you should not dry the surface of the denture. Okay, so it is common to develop some irritation, sore spots under new denture or partial denture. When this occurs, please, take an appointment and get it scheduled for adjustments. And if you see an ulceration, you can give some gel present. If not, you can take care of the sore spot. Sometimes there might be overextension, sometimes there might be something or the other. It can be taken care of. And the patient should also not wash the processes with hot water. Normal tap water is fine, guys. Okay, and the patient should start chewing soft things and then proceed to the hard things. The patient cannot chew extremely hard things, because at the end of the day, it is an artificial processes. So almost same instructions follow for the complete denture patients as well, guys. Okay, so always give a post insertion instructions for any case, CD, RPD, or FPD patients. Okay, coming to problems and their management. All the patients receiving, CD or an RPD should be seen within 24 hours after the insertion of the prosthesis. Yes, patients do not come 10 times, so we usually tell the patient to call after 24 hours if there is a problem. If not, we do a recall after 1 week. This follows for RPD and CD, guys. Okay, so if potential problem is detected, it's better to be collected at an early stage. The patient may never be subjected to pain and discomfort if we follow this pattern. That's true, but sometimes patients still do keep coming, and you have to identify the problem and sort it out. If there is any problems, the patient should be reassured that some problems can be solved rapidly and simply. Okay, so things should be solved. Okay, so most common complaints the patient comes for is pain or discomfort arising from the hard or soft tissue of the edentulous area. Okay, so they will identify one point, and when you tell them to point, they will point it out. It can be corrected. Soreness, ulceration is a common thing which is developed from a new prosthesis, especially to a new denture wearer. Miscellaneous things can be instability of the prosthesis, tongue or cheek biting, speech difficulty, eating difficulty. So identify the problems and see where how you can improve these problems. Okay, it can be due to many reasons, so we'll just talk about the causes. Okay, and then maybe I'll sum it up at the end of the lecture. So the causes are overextension. The denture flange must be reduced. So degree of overextension can be determined by visual examination. With the prosthesis in place, the buccal tissue should be manipulated downward, outward, upward, anterior, superior direction. So guys, same bottom molding movements can be done, and you can check if there's any lifting of the denture. If the denture is overextended, the movement will be impeded, and if interference with the movement and a change in soft tissue are evident, the denture flange must be reduced. So yes, guys, so you can do the thing and check, okay, if there's an overextension or extension in the lingual aspect of the mandibular denture. Edentulous ridge may be identified and confirmed by manipulation of the patient's tongue. Okay, a forward or lateral thrust of the tongue usually will disclose the location of the overextension. So then tell the patient to protrude and do lateral excursion of the tongue. Anywhere lifts up, or you can see the areas with it is touching or not touching, especially touching and impinging. I'm sorry, if we are talking about overextension. Okay, so it is usually used to verify or isolate any area that has any visible observation, any suspicion you can just see. And border extent is supposed to be corrected with the lab burr, with our acrylic trimming burrs. And again, you can tell the patient to do warm saline mouthwash for 4 hours, and you don't need to really give any local anesthetic agent. If you see the patient even after 24 hours, even after later after 24 hours too. Okay, all right. Thing is occlusal prematurity. So yes, there can be an lack of occlusal disharmony is the greatest factor on prosthetic related discomfort. Soreness or pain is not caused by presence of RPD. Okay, and it is due to an occlusal trauma, guys. Okay, so one of the most common reasons of discomfort here is the occlusal interference, which is between the natural teeth in one arch and the metal of prosthesis in the opposing arch. I just gave you that example that if my rest teeth is high on or like a 2-4 and occlusal receipt, and I am occluding with like a 3-4. You understand? Sometimes you might have premature contacts, and so you will have to take care of that prosthesis up there. The metal framework might be too thick, and you'll have to trim it off. Use an articulating paper. Even after trimming that off, if there are high points, yes, you can tell the patient to do grinding of the teeth and forward and lateral movements, and you can take care of the prematurities. Okay. So it is difficult to identify it with the articulating paper sometimes, as it marks on the highly polished metal surface. So if articulating paper marks are difficult to identify, the surface of the metal may be roughened using a fine stone burr airborne particles abrasion system like articulating paper. So anyway, so If it is difficult, you can just roughen it out, or you can identify and just trim it off. But then yes, you'll have to finish and polish that a little bit more. Okay, after you're done. So adjustments are made using a multi-fluttered burr in a high-speed handpiece. So yes, things can be done. Okay, sorry. So the miscellaneous problems are problems with phonetics, tongue biting, and loose denture. So problem with the phonetics when placed too palatally, the artificial premolars may interfere with speech. So, correcting the prosthetic tooth placement will correct the phonetic difficulties. So, yes, we usually do all this in the Trine procedure. So, guys, Trine is a very important procedure. Whatever correction you want to do, get it done in the Trine procedures. Otherwise, you'll have to probably redo the whole thing, because or reline, rebase the whole thing. So we can check each and all of these things during the Trine. Yes, few things come up when the patient starts wearing new prosthesis. It can be taken care of, guys. Okay. So cheek or tongue biting means there is might be a linear ulceration on the buccal mucosa. Then check the biting may be minimized by rounding off the mandibular buccal cusp. Okay, so yes, you can have it rounded off a little bit, and yeah, have it rounded off, and um you have to see the extent, guys, again, or check high points, see the extent, is it overextending somewhere. But usually you can see the bites, and you can assess the biting, or the cheek or the tongue biting. Okay, and the placement of the teeth also should be fine. If they are placed too buckly, then this will be a problem. So usually you have to take care of all these things indirectly in the Trine procedure. Okay, so we don't lead to these problems. Loose dentures, a fatigue or mishandling of class, adjust or remake. So if yes, sometimes we do realize that in the CPD design, the lab has sent us sometimes there the clasp is a little loose or tight, so we can adjust, and we do need special pliers for that, very stable pliers. So I we do use some ortho pliers, and we can just stabilize and adjust that. If again a problem, we might have to redo it if it's like too loose, and then you might not be able to do something. There are ways to manipulate things and make it tighter, but again, if you follow a proper principle treatment, you might have to remake the prosthesis. Okay, guys, so that's all for now, and you need to take care of the causes, and you need to take care how to manage them. You need to give them proper post-op instructions, and you need to examine the framework properly. Otherwise, yes, there will be a problem after the patient has the denture, after you've issued the denture, and then if you take care of these problems before, it will not be so complicated. But if we leave it as it is, it will be complicated later. Okay, so let's not complicate things for the patients and for ourselves, and check these things out, and we can work well together, and you need to know what and explain everything to the patient step by step, that these things can happen, and there can be problems. So if the patient is well informed, he will know how to deal with it. He or she will definitely will have to do. That's why recall visits, follow-ups are very important, guys. Okay, so from this lecture you would understand triumphs and follow-ups are very important, guys. Okay, so do it for all the procedures, and things should be fine. Okay, so thank you so much for patient listening, guys. Any problems, any questions, I'm always there on Polyclinic 3. Come and see me. And yes, for RPD issues or things, you can refer to RPD textbooks, which are McCracken, guys, and Stewart's. Okay, so these are the standard RPD textbooks. So these are the name of the authors. I'm sure you must be reading to them. So you can see them, you can refer to articles. And if anything else, so please let me know, guys. And yes, I'll be able to help you. Okay, thank you.